House reopened to the public today for the first time in nearly 2 years. Here to answer your questions is Dr. Helen Boucher, the interim dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. Great to have you here, Dr. Boucher.
Nice to see you, Erica.
Well, so as you know, our State House has been closed to visitors longer than any other Capitol building in the continental U.S. So do you agree that today was the right time to open? And are case numbers still important to you, or are you focused on some other data right now?
Well, so we'll take them in two separate parts. So I think it's good that the State House is reopened. They have good safety measures in place requiring masks and that folks are either vaccinated or have been tested. So I think it's safe to come to the State House if you want to. In terms of the metrics that we're watching, we're less focused on case numbers today due to the fact that there's a lot more things influencing those numbers, and we can't count home tests, for example. So we're focused on hospitalizations, ICU admissions, and deaths. And we're also making sure that our hospitals have enough capacity to care for sick people should they need us. The good news is that all of those metrics are going in the right direction today.
It's what we like to hear, Dr. Boucher. Okay, so as you know, we're always getting questions from viewers. So here's one from Pam, who writes, I have an immunodeficiency. Should I get a second booster? And if so, how long after the first booster?
Yeah, so really good question. And it's important to point out that in immunocompromised people, they actually need an extra dose of vaccination for the first effect. So if they get mRNA vaccines, if you got an mRNA vaccine, the Pfizer or the Moderna, you would need a third dose for initial effectiveness. If it was J&J, you'd need a second dose for the initial effectiveness. Then you also need a booster, and that booster is at least 3 months after the second dose for the mRNA, or after the third dose for the mRNA or the second dose for the J&J, excuse me.
Got it. Okay, well, finally tonight, we want to share our condolences with you and the entire Boston medical community following the death yesterday of Dr. Paul Farmer, of course, the founder of the incredibly impactful nonprofit Partners in Health. So if you could just reflect on his incredible work, what are you telling medical students today about his impact truly around the world?
Yeah, well, Dr. Farmer had an amazing impact around the world and saved many, many, many thousands and hundreds of thousands probably of lives, and was a true social justice warrior. I think what people don't know or aren't talking about as much is that he was a very amazing infectious disease doctor. And I was fortunate enough to be taught by him a little bit during my training, and he loved the practice of infectious diseases and trained many, many of us. So his inspiration will live on, and I think our students should all be inspired by that as well as his social justice work.
Dr. Helen Boucher, thank you so much, as always, for joining us.
Thank you.